What is sleep apnea? Sleep apnea is a common sleep disorder that affects millions of people worldwide. It is characterized by pauses in breathing or shallow breaths while asleep and can deprive the sleeper of a restful night's sleep. In severe cases, sleep apnea can cause daytime fatigue, irritability, and even strain relationships. Although commonly associated with snoring, not everyone who snores has sleep apnea. Understanding what causes sleep apnea, the symptoms to look out for, and how it can be treated is important for getting a good night's sleep. What is sleep apnea? Sleep apnea occurs when the airway in your throat becomes blocked during sleep, causing interruptions in your breathing. The blockage can be caused by a variety of reasons, including the relaxation of throat muscles, the shape of the jaw or tongue, or too much tissue in the throat area, like an enlarged tonsil or extra fatty tissue. The most common type of sleep apnea is obstructive sleep apnea, OSA. This type of apnea occurs when the soft tissues at the back of the throat collapse and block the airway, interrupting your breathing several times throughout the night. Other types of sleep apnea include central sleep apnea, CSA, which occurs when the brain fails to properly signal the muscles to breathe, and complex sleep apnea syndrome, CSS, which is a combination of the two. Sleep apnea can occur at any age, but is more common in men over 40 years old and those who are overweight or obese. It is also more common in smokers, as well as those with large tonsils, a deviated septum, high blood pressure, heart condition, diabetes, or any other chronic health issues. What causes sleep apnea? There are many factors that can contribute to sleep apnea, such as the shape of the tissue in the throat, the size of the tongue, the position of the jaw, or an increase in fatty tissue in the neck area. Some people may be born with a genetic predisposition for sleep apnea, while others may develop it due to lifestyle choices or other medical conditions. Certain lifestyle choices, such as smoking, drinking alcohol, or using sedatives, can contribute to sleep apnea. Also, obesity is a major risk factor, as excess fat around the neck and throat can narrow the airway. Those with nasal congestion, allergies, or a deviated septum are more likely to develop sleep apnea. Sleep apnea can also be caused by certain medical conditions, such as endocrine disorders, a stroke, or a tumor in the brainstem or hypothalamus. Neurological disorders, like Parkinson's disease, can also lead to sleep apnea. With so many potential causes, it is important to know and recognize the signs and symptoms of sleep apnea. Understanding these can help you get the treatment you need in order to enjoy a full and restful sleep. Signs and symptoms of sleep apnea. The most common symptoms of sleep apnea are loud or frequent snoring, snoring that is loud or frequent enough to keep your partner awake. Episodes of pausing or stopping breathing during sleep. This can last for seconds or minutes and can happen as often as several times a night. Gasping, snorting, or choking noises that happen when breathing resumes. Daytime fatigue. This could include feeling tired, even after sleeping for the recommended amount of time, difficulty concentrating, and having trouble staying focused on tasks. Depression or irritability. Sleep apnea can interfere with a person's mood, leading to depression or irritability. Headaches. Headaches are a common symptom of sleep apnea, usually occurring in the morning after a night of disrupted sleep. Waking up with a dry mouth or sore throat. Sleep apnea can also cause more serious long-term effects, such as high blood pressure, an increased risk of heart attack and stroke, and weight gain. It is important to recognize the signs and symptoms of sleep apnea and seek medical help if you are experiencing any of them. If you suspect you or someone you know may have sleep apnea, it is important to speak with a doctor for diagnosis and treatment. Diagnosis of sleep apnea. Sleep apnea can be difficult to diagnose since the symptoms may be subtle and easily confused with other medical conditions. To confirm a diagnosis, your doctor will usually ask you about your symptoms and medical history. They may also recommend certain tests, which may include a physical exam, a sleep study, and/or imaging tests such as X-rays or an MRI. A physical exam will help your doctor identify any risk factors for sleep apnea. This might include checking for an enlarged tongue, tonsils, or other structures that could block the airway. Your doctor may also listen to your breathing patterns to check for any abnormalities. A sleep study, also known as a polysomnogram, will measure how much and how well you sleep. During a sleep study, various sensors are placed on the body and electrodes are connected to the scalp. This allows doctors to track respiration, oxygen levels, and other body functions to look for signs of sleep apnea. Imaging tests are occasionally used to diagnose sleep apnea. X-ray images can show if the airway is narrowed or blocked. An MRI can provide more detailed information about the size of the airway, the presence of any obstruction, and any structural abnormalities. Once a diagnosis has been confirmed, your doctor will discuss treatment options with you. Depending on the severity of your condition, different treatments may be recommended to help manage your sleep apnea. Treatment options for sleep apnea. Sleep apnea is a serious sleep disorder that can severely affect your quality of life. The good news is that there are treatment options available to help improve symptoms and get you back to sleeping well. Treatment options include lifestyle changes and medical therapies. Lifestyle changes. There are several lifestyle changes that can help reduce or even prevent sleep apnea. These include weight loss. Weight loss has been shown to be the most effective way to reduce sleep apnea symptoms. Maintaining a healthy weight by exercising regularly and eating a balanced diet can help reduce airway obstruction. Avoid alcohol and smoking. Alcohol and smoking can relax the muscles in the throat and can contribute to sleep apnea. Avoiding these substances can help reduce symptoms. Positional therapy. Sleeping on your side instead of your back can reduce sleep apnea episodes. If positional therapy doesn't help, it may be necessary to use a device to help keep you from sleeping on your back. Oral appliances. A custom-fitted dental device worn while sleeping can help keep your airway open by repositioning your lower jaw and tongue. Medical therapy. If lifestyle changes aren't enough to reduce symptoms, then medical therapy may be necessary. This includes continuous positive airway pressure, CPAP. CPAP is the most common form of medical therapy used to treat sleep apnea. CPAP machines provide a continuous flow of air to help keep your airway open during sleep. Adaptive servo ventilation, ASV. This is a newer form of therapy used to treat central sleep apnea. ASV machines adjust the pressure they deliver based on the patient's breathing patterns. Surgery. For some people, surgery may be an option to help improve sleep apnea symptoms. Possible surgeries involve procedures to remove excess tissue in the airway, widen the airway, or reposition the jaw. It is important to talk to your doctor about the best treatment option for you. Preventing sleep apnea. Sleep apnea is a common disorder that occurs when your breathing is disrupted during sleep. While the risk of developing sleep apnea cannot always be prevented, there are certain lifestyle changes and preventive measures that can help reduce your chances of developing this condition. To improve your sleep quality and reduce the risk of sleep apnea, you should maintain a healthy weight. Avoid alcohol and smoking. Engage in regular physical activity. Get adequate rest. Stay hydrated. Practice good sleep hygiene, including avoiding caffeine late in the day and establishing a relaxing bedtime routine. Ask your doctor about changes to your medications that could improve your sleep quality. Complications of sleep apnea. Sleep apnea can have serious long-term health consequences if left untreated. The most common complications linked to this disorder include high blood pressure. Sleep apnea can cause your blood pressure to increase, which increases the risk for heart disease and stroke. Weight gain. Studies show that people with sleep apnea are more likely to be overweight or obese. This is because their body is not getting the rest it needs. Daytime sleepiness. People with sleep apnea often experience excessive daytime sleepiness, which can lead to poor concentration, slower reaction time, and an increased risk of car accidents. Mental health issues. Research suggests that sleep apnea may be linked to depression, anxiety, and other mental health disorders. Diabetes. Studies have found that sleep apnea is associated with an increased risk of developing type 2 diabetes. Left untreated, these complications can be life-threatening. It is important to work with your doctor to determine the best treatment plan for your sleep apnea. With appropriate treatment, many of the potential complications of sleep apnea can be avoided. In conclusion, Sleep apnea is a common sleep disorder that affects many people. It is characterized by repeated pauses in breathing during sleep, which can cause various health problems if left untreated. The diagnosis of sleep apnea is based on a patient's medical history and the results of a physical exam, sleep study, and possibly other tests. Treatment for sleep apnea includes lifestyle changes, medical therapies, and CPAP machine use. Home remedies and preventive measures can be employed to reduce the risk of developing sleep apnea and its related complications. Finally, useful tips for living with sleep apnea can help patients manage their condition and improve their overall health. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief.